KTN.
Away from politics to neighboring country Uganda, who are facing a critical public health threat. The World Health Organization has declared a public health emergency of international concern following a deadly Ebola outbreak that has crossed from the Democratic Republic of Congo directly into Uganda. The global health body has sounded its highest level of alarm, warning that this specific outbreak involves the incredibly rare Bundibugyo strain, leaving health workers without an approved vaccine. This comes as Public Health Principal Secretary in the country, Mary Muthoni, asked county governments to be prepared in case of any outbreak. Our reporter, Finiko Loch, breaks down what this means for the region.
It is a headline East Africa hoped it will not see again. An Ebola outbreak originating in the gold mining hub of Mombasa in the eastern DRC has officially breached borders. Uganda's Ministry of Health has confirmed 2 laboratory cases right in the heart of the capital, Kampala, including a tragic fatality involving a Congolese national at the Kibuli Muslim Hospital. The speed of transmission has triggered an immediate response from Geneva. The World Health Organization has designated the crisis a global emergency. But the frontline battle this time is uniquely dangerous. Unlike the more common Zaire strain, which can be managed with existing vaccines, there is currently no approved vaccine or specific drug treatment for the Bundibugyo strain.
Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response.
The Africa CDC reports that at least 88 people have already died across both nations, with over 300 suspected cases under investigation. The high mobility of traders, miners and families across the region means the risk of silent transmission is worryingly high. Yet, the World Health Organization is explicitly advising countries against closing international borders. The Global Health Body argues that sealing borders simply drives desperate travelers to unmonitored routes, making the virus impossible to track. Instead, neighboring states, including Kenya, are urged to heighten surveillance and prepare local isolation protocols. Health PS Mary Muthoni has called for thorough surveillance in the country and asked county governments to prepare emergency measures to combat the disease in case of an outbreak.
We are urging our healthcare workforce to ensure that there is enhanced surveillance to facilitate early detection and also to respond should there be an outbreak in Kenya. All points of entry, including the ground crossing border points, airports, seaports, we have directed that there must be enhanced screening of all travelers that are entering Kenya, with special focus on passengers originated from the countries that have been identified or that are affected.
The crisis is further complicated by severe regional insecurity in the DRC and heavy reliance on informal health clinics, where at least 4 healthcare workers have already lost their lives trying to contain the spread. The WHO emphasizes that while this demands an aggressive international response, it is a regional emergency, not a global pandemic on the scale of COVID-19. The immediate priority right here in East Africa is containment, contact tracing, and getting experimental therapeutics into the field before the virus outpaces the region's healthcare capacity. Finiko Loch, KTN.
Moving on, President William Ruto